In this video, I'll show you a research paper which uncovered 5 potential running technique traits linked to injury. Welcome back, Run Smarter Scholars. Today we are reviewing one of my favorite papers. It is from the researcher Chris Bramah, who I've interviewed a few times on the Run Smarter podcast, and he always has a lot of wisdom to help identify any running injury risks. The paper is titled, "Is there a pathological gait associated with common soft tissue running injuries?" In this paper, they analysed 72 injured runners on a treadmill, and you can see here on the table, they had 18 participants with either patellofemoral pain or runner's knee, kneecap pain, ITB pain, shin splints, or Achilles tendinopathy. And they also analysed 36 healthy runners on a treadmill to see if they could find any differences between these two groups. Now, importantly, the paper made clear that injured runners were only included in this study if they could run up to 10 minutes before the onset of pain. Now, this is important because running while in pain can cause people to compensate and cause them to move and run in different ways. That's not what this paper is about. The idea is to take injured runners, have them run symptom-free, and then compare them to healthy runners. And like I said, they found 5 traits, so let's dive into them now. So the first trait that they found was an increase in the trunk flexion. This is the degree of the forward lean shown by the trunk at the hips, and the reason, while the paper suggests one possible mechanism explaining the differences in trunk lean may be due to strength deficits around the gluteals and paraspinals, which is essentially the glutes and the muscles that run along the spine. Previous studies have reported fatigue of the paraspinal and gluteal muscles to be associated with an increase in trunk flexion during running. So if you sort of elicit this trait, yes, it could be weakness or it could just be habit. So if you are finding yourself leaning a little bit more forward, using the cue just to run with a tall chest can be helpful. The second thing that this paper shown was an increased knee extension at initial contact. And the third thing that they found was increased dorsiflexion at initial contact. So essentially what that means, number 2, knee extension is just contacting with a straighter leg. And number 3, just being that there's a bit more of an upwards pointed toes when first making contact with the ground. And the reason behind these two traits that this paper suggests is a greater distance between your center of mass and your foot, as well as a greater ankle dorsiflexion angle, has been associated with increased joint loading and braking impulse. So essentially, in other words, it just means that you're generating unnecessary forces on the body. So if you are eliciting these traits, just a tip, try contacting with your foot more underneath your body. Doesn't matter if you contact with your heel, your midfoot, or your forefoot, as long as you bring that more underneath your center of mass, this should help a lot. Number 4 is what we call hip adduction, and it's essentially bringing the leg closer to the midline. And it's often seen in runners who can rub their knees together while running, or if someone scuffs their foot across their calf during that swing phase, it just means that their legs are closer to the midline than normal. And the 5th that they found, which was the most significant, was a contralateral hip drop, or a contralateral pelvic drop, which is essentially the opposite hip dropping towards the ground during mid-stance. The paper mentioned that it is likely that contralateral pelvic drops will influence the lower limb tissue stress at a number of different anatomical sites. For example, if you do have a hip drop, this might increase ITB tension. As that ITB tension goes further down the leg, it can increase the tension on the kneecap or the patella. And also, if you have a pelvic hip drop, it starts to shift the body more away from an up and down and more towards a side to side kind of action. And so this side shift might increase the tension in things like the shin and the Achilles. And the difference on both of these traits between injured and uninjured reached statistical significance, and the paper commented that the most important predictor variable was contralateral pelvic drop, with an 80% increase in the odds of being classified as injured for every 1 degree increase in pelvic drop. Like I said, this is one of my favorite papers, but it does have some limitations. So some disclaimers we need to make clear. First of all, this is only just one study. And while the population sample size was quite high, other studies and bigger systematic reviews have not yet linked these same traits to injury. In fact, due to the retrospective nature of this current study, We can't conclude that these traits will link to a future injury, but are elicited in those who are currently injured. And this is important because these runners might alter their patterns knowing that they are nursing an injury, even if their current running during testing was asymptomatic. So just a few final takeaways if you feel like you are eliciting the traits found in this paper. Number one is to increase your cadence by 5 to 10%. This can reduce your overstride, reduce the dorsiflexion, those toes pointed up, and can also limit the crossover step pattern if your step rate is quicker. And it's been shown that an increase in cadence can also increase the hip muscle activation, so potentially could help with that hip drop and those other hip kind of traits found, and can counteract a lot of the traits identified in this paper. Number two is to reduce your crossover pattern if you find that you are eliciting such a pattern. And all it takes is just to consciously take wider steps. Do it in a subtle way, because a lot of runners tend to over exaggerate when told to step wider. So just do it by a few inches, and this can also counteract the excessive hip adduction that was found. Okay, Run Smarter scholars, if you have learnt or liked anything, hit like so I know that I'm doing a good job and can help with future videos. If you have any questions about running techniques, leave that in the comments below and I'll be sure to answer them. I have also done another video on step width, which I highly recommend. You can go check that out.